Hello everybody, this is Christopher Savini. I'm the Program Director for the Chemical Dependency Program. Today we're going to discuss the COVID-19 related trends in substance abuse and prevention. Introduction and what we're going to discuss today. Alcohol and illicit substance use and how it's increased during the pandemic. How surveys indicate that alcohol and illicit substance use has increased at higher rates in the states hardest hit by COVID-19. The convergence of the opioid epidemic and the COVID-19 virus pandemic and how it's created new healthcare challenges with increased risks for overdose and access to healthcare. Alcohol and substance use among healthcare workers. Start with a list of the most commonly used substances during the pandemic. Alcohol comes in at 88%, marijuana use at 37%, prescription opioids at 15%, benzodiazepines such as Xanax, Ativan, and Valium at 11%, prescription stimulants such as Adderall at 10%, and cocaine at 9%. Now let's take a look at the increase in the substance use. From March 13th, 2020 to September, 5% of the people surveyed reported an increase in past month alcohol consumption, with 18% reporting a significant increase. 36% reported an increase in illicit drug use. In the states hardest hit by the coronavirus, New York, New Jersey, Massachusetts, Rhode Island, and Connecticut, 67% of the people reported an increase in past month alcohol consumption, with 25% reporting a significant increase. 1 in 4 adults reported a change in alcohol use almost immediately after stay-at-home orders were issued. Take a look at alcohol and substance use in healthcare workers during the pandemic. The COVID-19 pandemic resulted in unprecedented stress on healthcare systems throughout the world. Essential workers faced increased infection risks. They also faced higher rates of stress due to the pandemic. These factors can be compounded in essential workers and place this group at a particular high risk for substance use and abuse. Let's take a look at the opioid epidemic and the pandemic convergence with high fentanyl positive test results, with 70% less tested being done. 35% increase in fentanyl positive tests. 44% increase in heroin positive tests. 89% of all amphetamine tests tested positive for fentanyl. 48% of all benzos tested positive for fentanyl. And 34% of all cocaine tests were positive for fentanyl. This led to a much higher mortality rate. In essence, what this means is most of the illicit mood-altering drugs being bought on the street were cut with fentanyl, and testing was testing at a higher rate even when there was 70% less testing. This is what leads to the higher mortality rate. Why was there an increase? Of all the people surveyed, 32% of the people said they were coping with anxiety and depression, 39% were trying to relieve boredom, and 53% said they were trying to cope with stress. In conclusion, alcohol and drug use has increased since the pandemic began. Coping with stress, boredom, anxiety, and depression are the highest contributors for the increased use. Essential workers are high risk for alcohol and substance use due to COVID-related stress. Less testing has been done, and dealers combining drugs with fentanyl put illicit drug users at a much higher risk for death. Please, if you or a loved one is having a problem with any mood-altering substances or alcohol due to the pandemic, please contact the CD program and we'd be happy to help you. Hello, this is Christopher Savini, the Center of Rapid Recovery's Chemical Dependence Program Director. Today I'll be presenting the CD program's Overdose Narcan training. Topics of the training include: what are opiates? What is an opiate overdose? What is Narcan, naloxone? What puts a person at risk? Facts about fentanyl, signs and symptoms of overdose, how to respond to an opioid overdose. What are opioids or opiates? Opiates are drugs derived from opium, with opium being the natural component. At one time, opioids referred to synthetic opiates only, drugs created to emulate opium, however, different chemically. Now the term opioid is used for the entire family of opiates, including natural, synthetic, and semi-synthetic. Here are some pictures of natural opiates. Right here you have the poppy plant, and that's where they derive morphine and codeine from. Then you have semi-synthetics, which include heroin and OxyContin, Percocet and oxycodone, and then you have full synthetics, which include fentanyl, methadone, and buprenorphine. Let's discuss opiate overdoses and what is happening to the body and brain. Essentially, an opiate overdose is a slow shutdown of the respiratory system. Opioids smother the receptors in the brain which control breathing. If goes untreated, the 5 major organs will shut down: brain, liver, kidneys, heart, lungs, which can lead to possible death. What is Narcan or naloxone? Naloxone, commonly branded as Narcan, is an opiate antagonist medication that can help reverse an opioid overdose. Active for 30 to 90 minutes and shorter with fentanyl, it usually works within 2 minutes but may take up to 5 minutes to work. There are different formulations of naloxone that are currently available. You have a multi-step nasal, an auto-injector, single-step nasal, and an IM naloxone. Let's discuss who's at risk for overdose. Anyone who has taken time off from using, for example, detox, residential programs, or jail, is at risk for overdose because of a reset tolerance to the opioid drugs. Anyone who's experienced or new is still at the same risk for overdose. Who else is at risk? Someone who has OD'd in the past and has survived is at risk, and those who smoke opioids, smoke or inject opioids. Now let's talk about the difference between either being really high or actually overdosing. And this can be really important, saving somebody's life. Really high, somebody will be nodding but responsive to a sternal rub. Not responsive is overdose. If you rub them on their sternum and you don't get any reaction, the person is possibly overdosing. Not speaking, the person is possibly overdosing. When they're really high, their speech is only slurred. Really high, a person is sleepy, intoxicated, but breathing. A person usually and should be breathing at least 8 or more times per minute. Now with somebody that's overdosing, they're breathing less than 8 times per minute. Breathing is stopped, is slowed. You may hear choking sounds or a gurgling or snoring noise. Their lips might be blue or purplish, same as their fingertips, and their skin would be gray, cold, and probably clammy. Look at both sides, it's really important. Either way, even if somebody's really high, that does not mean that they're not a step away or minutes or seconds away from actually overdosing. When somebody's really high, you want to just stimulate them and observe them. You want to keep them talking, and you want to increase how many times they breathe per minute. If somebody is not responsive and somebody meets the overdose criteria we just discussed, you want to call for help, do CPR, and inject naloxone. Now let's do a very important signs and symptom review. When somebody's overdosing, their breathing is very slow, irregular, or has totally stopped. Remember, less than 8 times per minute. You'll hear choking sounds or a gurgling, snoring noise. They'll be unable to respond, unresponsive. Their lips will have a blue skin tinge to it. Usually, like I said, lips and fingertips show first. Their face will be very pale. Their pulse or heartbeat is very slow, erratic, or not there at all, and they'll generally be passed out. Once again, how to respond to an overdose. Assess the signs that we just discussed. Stimulation, touch the person, rub the person's sternum. Some people have been known to throw ice on people and see if they get a response. If that doesn't work, immediately use Narcan or naloxone, call 911. If the person does not wake immediately after administering the first dose of Narcan, administer CPR with breathing. After 2 or 3 minutes of CPR, if the person has not responded, you may now administer the second dose of Narcan. If you must leave the person, it's very, very important to leave them in the recovery position, which is on their side in the picture. Temporarily leave them, make sure you call 911, and come back as soon as possible. Now let's review calling 911 and why it's important to call 911. First off, Narcan only works on opioids, so if the person overdosed on Xanax or other benzodiazepines, Ativan, Klonopin, or drugs like that, cocaine, alcohol, or other drugs, you have no way of knowing what they've ingested. There's a possibility they might have ingested not only opioids, but another drug, and they might be overdosing on both. Another reason is the person might have medical issues. The person might have overdosed on cocaine and had a heart attack. And another very, very important reason is some of the synthetic opioids out there right now are so strong that you could administer Narcan, the person will actually become responsive and then overdose all over again once the Narcan wears off. Narcan generally stays in your system 45 to 60 minutes. This is a single-step Narcan nasal spray. There's a reason why I included this picture, and that reason is this is the type of Narcan that we use at the CD program if and when there is a possible overdose. This should also be the type of Narcan that you have at your CRR program. If you do not have a single-step Narcan nasal spray or you do not know where it is located within your program, please speak to your immediate supervisor and we'll ensure availability. If you should have any further questions about somebody overdosing, about a family member who's using opioids, or anything opiate related or overdose related, please do not hesitate to call us at the Outpatient CD program. We'll be happy to assist you in any way possible. I hope you never have to use a single-step Narcan nasal spray once in your life. Thank you and have a great day.